Hi, I'm Isabella Galichia,
And I'm Dr. Jody Galichia.
and in today's video, we're going to be talking about strokes.
Now, strokes are very, very much a major problem because if you have a stroke, that means it affects the brain. And of course, the brain is a master organ of our body. So we've got to have proper blood flow to the brain, and interruption of that blood flow results in a stroke. Now, strokes can occur in many ways. They can occur in a large part of the brain and cause major damage, inability to speak, maybe not being able to walk properly, not being able to think properly. So they're just a host of symptoms that occur when you have a stroke. But the cause of the stroke almost always is inadequate blood flow to the central nervous system, to the brain. Now, more people are surviving strokes today because now we often can go in, dissolve the clot that's causing the stroke, and enable the blood flow to be restored, and sometimes enter the brain circulation and do a balloon procedure or something to almost immediately restore the blood flow. If we do that, we can minimize the damage to the brain and minimize the stroke. So it's got to be treated right away. It's not something you can sit back and say, I'm not sure what's going on. Maybe my speech is a little slurred. No, that's an immediate trip to the ER.
Thank you. And if so, I had a loved one who recently had a stroke. What would be some of the questions that I should tell them to ask their doctor?
Well, I think one thing is, why did this occur in the first place? Did I have high blood pressure? Did I have a heart rhythm disturbance like atrial fibrillation, where a small clot embolized, went to my brain and shut off the circulation? Is there some underlying cause of this? And the causes are hugely long, just a myriad of symptoms and problems that can cause strokes. So controlling the blood pressure, controlling the diet, controlling the cholesterol, those are all things that your doctor is going to say, yeah, that's what you got to do. Now, something else that one should ask the doctor is, do I need to take blood thinners? And if I do I take major blood thinners that can cause more bleeding, or do I take antiplatelet drugs, which can simply thin the blood in a milder way and have less chances of causing you to have bleeding somewhere else? So the risk of the blood pressure medicines that you take, the risk of the blood thinners that you take, and the need for follow-up is incredibly important here. Follow up with the blood pressure, follow up with the blood thinners, follow up of you as an individual then to see how you're functioning. Are there new problems? And then, of course, examining the arteries in the neck and elsewhere that lead to the brain that could result in a stroke.
Thanks, doctor, and thank you for watching. And be sure to visit hearthealthcommunity.com to learn more about strokes.